up from Martin Luther King Drive, and we had about 800 patients that came through the gate and were lined up this morning when we first started. We've gone through probably half of those patients so far in terms of their registration, their patient education, had them qualified and had a medical clearance, had x-rays taken and treatment. So that's been a very good thing. So the pace is what we expected. All of the hard work that went into the organization and the planning for this is really paying off. We started this in earnest probably last February, so we're less than a year off, and just a lot of great people that have pulled together and a lot of effort and time spent to make this a success.
Tell me, how underserved is dental care, especially with patients who don't have adequate health insurance?
That's a very good question, and it's a very common question. And I'm not going to give you the Reader's Digest answer. It's going to be a little more detailed. The colleagues of mine that you see here all do pro bono work in their offices, and they want to help, and it's representative of our profession. The challenge is that the state of Florida is ranked about 48th in the country for Medicaid reimbursement, and so the reality comes down to one where a business decision needs to be made. If Medicaid reimbursement is covering 50% of the overhead, not the profit, the overhead in the office, then it only becomes a matter of time before the dentist says, I can't do this anymore. I can't afford to do this. It's just not a good thing. So the main reason we're here today is to get people out of pain. This is not a healthcare delivery system. It's not comprehensive dentistry. But the other really important part of this is raising the awareness of the tremendous need that we have. The buzzword is access to care. Well, who does this population of patients represent? You're seeing them right here, okay? They cannot afford treatment in terms of priorities in their own economics of positions. It's way down on their list of priorities. And so what happens is their oral care suffers and tends to spiral out of control. I will give you a little anecdotal story. I had a patient today by the name of Gary. Gary needs all of his teeth removed. He's 35 years old. And for reasons that we don't have to go into, he's just had some challenges in his life. So we took Gary as a little bit of an exception, and I thought we could possibly make some full dentures for him. I was made aware of the fact that we actually don't have the equipment for that. Maybe another day, maybe another event, we will be prepared for something like that. So when I actually broached the subject with him and gave him the news, I thought he would be disappointed, okay, because not only is he having his teeth out, but maybe with the hopes that he would have a set of dentures when he left. And in our private offices that's possible, but unfortunately it wasn't. So what's the point? The point is Gary started crying. Now why was Gary crying? Well, I thought it was because he was concerned that he wouldn't have a set of dentures. It was actually tears of joy. He was so happy that somebody could take his teeth out, which is kind of interesting, and it speaks to the human condition, because he's in so much pain. So we're helping him, and yes, he'll be okay, and maybe if he gets on his feet, he can work through the process of actually obtaining a set of dentures to help him. So we've gotten him out of pain. Have we helped him aesthetically? Probably not. Have we helped him functionally? It hasn't really improved or made things worse, certainly, because he had a problem before. But the answer is going to be some form of comprehensive approach to this problem. So that's one example, and we hear that over and over and over again throughout this entire clinic, throughout the whole morning. We've been at this since 5 o'clock this morning. It's 11 o'clock right now, and we're not halfway through the day.